Dr. James Byland. I'm the owner and director of the Byland Clinic.
Hi, my name is Danielle Morales. I'm a licensed educational psychologist and the co-director of the Byland Clinic. And today we're talking about dyslexia for parents. So specifically what dyslexia is, how it compares to other reading disorders, why getting a diagnosis of dyslexia versus another type of reading disorder matters, as well as how to make sure that your child is getting the intervention that they need for dyslexia. So, James, to start off today, can you explain what the difference is between dyslexia and other reading disorders? Because I think sometimes there's a tendency to lump all reading disabilities together, and there are different subtypes. So, can you talk through that nuance?
Yeah, for sure. No, and it's an important question, especially for parents of children who are being assessed through the school district, because they just kind of call everything a specific learning disability, and they don't sort of drill down and identify, well, what type of reading disability is that? And of course that's important because when we know what it is specifically, we know specifically how to address it. So when we're talking about dyslexia, we're really talking about this unexpected underachievement in basic word reading, reading fluency, and spelling. So it's really a word level reading disability. And when I say unexpectedly low, it's unexpectedly low given the child's age. It's unexpectedly low given the child's educational history. It's unexpectedly low given their measured intellectual ability. So essentially their ability to read words, read them quickly, and spell them is much lower than you'd expect given all those factors.
Okay. And so, can you talk through how comprehension intersects with dyslexia?
Yeah, so that's right, the distinction between them. So there are different types of reading disabilities, and again, if it's a word level reading disability, like I just described, we call that dyslexia. There are other reading disabilities that just affect comprehension. So now, certainly, if you have a word level reading disability, it will affect comprehension. If you're not reading the words accurately and you're not reading them quickly enough, you're not going to be able to understand what it is that you're reading. But there are some kids who have a hard time with reading comprehension, even though their word reading accuracy and fluency is intact. And we call that a disorder of reading comprehension. So it's different than dyslexia. And usually in those cases, and we can kind of talk about what some of the underlying processes involved are, but there are some areas of neuropsychological processing that are really specific to word level reading. And usually when we find dyslexia, we find deficits in one or more of those areas. But somebody could have all of those skills intact, but maybe they have a more difficulty with just general language comprehension, or verbal memory, or verbal working memory, these abilities to kind of keep track of what they're reading and make sense of what they're reading. And those usually underline these just general reading comprehension difficulties. And usually when that's the case, you also see difficulties just in listening comprehension. Because again, the comprehension challenges aren't specific to reading themselves. It's more of a general language comprehension difficulty.
Okay. And so those are some of the processing deficits that underpin more of the comprehension or language-based, reading disabilities. What about for dyslexia? What are the areas that parents should make sure are being assessed and looked at for processing disorders for dyslexia specifically?
Yeah, and this is really important when we're looking at school-based evaluations too, because one of the things that schools are looking at is whether or not they identified a processing disorder. And so when we have a child with a word level reading disability, it's really important that we're being sure to assess in all the areas of processing related to reading development. Number one of those is phonemic awareness, or sometimes they call it phonological processing, essentially the ability to process the sounds within words. So, when I'm talking right now, I don't pause in between each word, let alone between each sound. But our brain has this remarkable ability to listen to a word and segment it into its individual sounds. We know where one sound ends and the next one begins. We can blend those sounds together to form words. We can segment or take those sounds apart. We can rearrange them. We can substitute sounds in order to form new words. And all those skills are called phonemic awareness, the ability to process those sounds within words. So the phonemes are the individual sounds within words. And that's really the root deficit for kids that have dyslexia, but there's other related areas of processing that can be impacted as well too. So one of those is called orthographic processing. It's really sort of the visual aspect of reading, the ability to remember whole word forms. So when we're learning to read, we rely very heavily on our phonemic awareness to be able to kind of crack the code. As we become proficient readers, we're obviously not sounding out words. We're reading 3 and 4 words at a time as our eyes scan across the page. And we're able to do that because of orthographic processing, the automatic word recognition. And then the third area we want to make sure that we take a look at is what's called rapid automatic naming. And again, this is just related to how quickly our brain's able to make an association between the text symbol on the page and the letter name or sound that it represents. And again, sort of related to that, the automaticity of reading.
Mhm, mhm. Okay. So just to summarize, right, we're looking at two different types broadly of reading disorders, things that impact the foundational or front end of reading, which are a dyslexic presentation, or issues with language or comprehension that may be due to other processing areas, such as, difficulties with expressive language or auditory working memory or verbal memory. So can you talk through why a diagnosis of dyslexia versus SLD or specific learning disability under IDEA matters in intervention planning?
Yeah, and this is honestly a reason for a lot of the referrals that we get for IEs. Reading disabilities are relatively common. They're identified in schools and kids are receiving services for them, but parent will come to our office and their child maybe was identified as having a specific learning disability, but the parent feels that they have dyslexia. Now, in all fairness, school psychologists are credentialed to make recommendations around special education eligibility. They're not licensed in California to make a clinical diagnosis, like we are as clinical psychologists and licensed educational psychologists. But parents are interested in that information, and honestly, for very good reason. If we don't know what the nature of the reading disability is, we don't necessarily know how to treat it, right? And if we're just given this umbrella term, specific learning disability, without really knowing what exactly that specific learning disability is, then we're really just guessing at what we're going to do to be able to help them. If we assess and identify dyslexia more than any other, learning disorder, we have a very clear roadmap in terms of how to treat dyslexia. And if we can accurately identify it through our assessment, then we know very clearly what we need to do in order to treat it.
Mhm, mhm. Yeah, so I think that speaks to the need, A, for clinical diagnosis, but B, if that's not available to parents. I know we've spoken previously, excuse me, about IEEs or those independent educational evaluations where you can get a clinical diagnosis or differential diagnosis between these different types of reading disabilities. But I also think another thing to elevate is to look for the processing areas we just talked about, right? So if you did get a psychoeducational report done through the school, and you are seeing markers of dyslexia, meaning, impacted phonological processing, impacted orthographic processing, then there should be a recommendation for structured literacy that accompanies the interventions that are being offered. So can you explain what is structured literacy and why it is so important for kids with dyslexia?
Yeah, so it's what we found is scientific-based structured literacy instruction is, for most kids with dyslexia, going to be the treatment of choice. 80% of kids that have dyslexia are going to respond positively to scientific-based structured literacy instruction. So those are intervention programs that one are going to address things like phonemic awareness. They're going to teach phonics. They're going to work on developing fluency. They're going to work on vocabulary development and comprehension strategies, but they're going to do it in a really specific way. So the interventions are very structured. They're delivered in a very step-by-step fashion, where we're introducing a concept, we're reviewing that concept, the child is practicing that concept to mastery before we move on. It's very systematic in that we're really starting with very basic phonemic awareness and phonics skills and going from basic to complex. And so each skill is building on the previous skill. And it's explicitly taught, right? Meaning that we're sitting down one-on-one or one to small group with the student and the teacher, and they're teaching those skills explicitly. They're doing sort of formative assessments as they move on. Sort of they're reinforcing the skill, and it's not not something that can be replicated, say, with like a computer-based program, in terms of that explicitly taught aspect of it.
Mhm, mhm. And another question that comes up a lot when parents are looking at, say, the district's offer of FAPE, free and appropriate education, or structured literacy, or are shopping around for private interventions that they fund on their own is how to know if they are investing in a good quality program or if what the district is offering is research based. There's a lot of names that parents may have familiarity with, like Linda Mood Bell, Barton. It's also newer programs like Sonday or Phonographics. So, how do you find research on programs? How do you know if your child is being offered a good quality research based program?
No, it's really an excellent question, and there's really a lot of factors to take into consideration when determining whether or not the program and provider is appropriate, for a child. David Kilpatrick is really sort of a leading researcher in this area, currently on word level reading disabilities, and he's done quite a bit of study on trying to determine what are the most effective programs for kids that have dyslexia. And what he's found, there's three really critical elements, right? One of them is the program teaches phonemic awareness to an advanced level. And I suppose we can talk a little bit about what that means too. But they teach phonemic awareness to an advanced level. They have explicit phonics instruction, decoding instruction, and they provide ample opportunities for the child to read connected text to build fluency. And he found that when programs involve all three of those components, they tend to get the best results. Now, programs that get moderate results, but not as strong as programs that include all three elements, are programs that are missing an element, right? And it may be that they teach phonemic awareness, but they don't teach it to an advanced level. So they just teach sort of basic phonemic awareness, and then they do decoding and reading connected text. And those programs are sort of mildly to moderately effective. And then the programs that are least effective are ones that don't include explicit phonics instruction. So I think if we're looking for programs, we want to look for ones again that teach phonemic awareness to an advanced level. We want to have programs that include an element of phonics and again ample opportunities to read connected text. There's a lot of different programs out there that are marketed as structured literacy or Orton Gillingham based or based on the 2000 National Reading Panel. But it is important to go back and take a look at what exactly is that program delivering.
Mhm.
Programs, for example, that I see in districts right now popularly are Spire, and then also I see Language Live. And one of my major criticisms of those programs is it's a combination of computer-based instruction and human interaction instruction. And you cannot, in my opinion, I haven't seen a program that is computer-based that does an effective job of teaching phonemic awareness to advanced level, teaching phonics, and it's just there. It's unable to provide that structured, explicit instruction that's really required for effective intervention. So they advertise themselves as having, all of the components of effective reading programs, but they're not actually effective in treating dyslexia.
Mhm.
I would sort of along the same lines, and this kind of goes beyond just what the program proclaims to deliver, is also who's delivering the intervention. So, one of the other things with the program Spire, for example, one of their marketing highlights for districts is that it takes very little training to get somebody up and running with Spire. That's problematic because it's not just a matter of having a program or a script to follow, but somebody that really has the training and expertise for dyslexia intervention. And that's not something that just happens overnight. And so we could have the same program delivered by two different people, and it could result in two very different outcomes.
Mhm. Mhm. And in addition to program quality or some of the nuances and what's contained in the curriculum, can you talk through how the intervention should be delivered? So, for example, how many kids should be in the group? How often should structured literacy be delivered to students?
Yeah, no, it's really important point, right? So there's this 2000 National Reading Panel study that really took a look at what is effective reading instruction, what is effective reading intervention for kids that have word level reading disabilities, and they said again hands down that structured literacy instruction was the most effective approach. But they also looked at some of those other variables like how often do we need to receive intervention? How long should that intervention go on for? How large should the group be? And what they concluded is that two things that really matter quite a bit are the size of the group and the frequency of the intervention. And the size of the group ideally should be 1-to-1. You're going to get the best results based on that because the interactions between the child and the student, between the teacher and the student rather, are going to be based on that student's needs. So one-on-one is ideal. They said not more than 1 on 3, and if it's up to 3 kids, then those kids should be matched in terms of their reading ability and skills that they're working on. Uh, they also said that frequency really matters a lot. And so it's really important that you're getting this reading intervention 4 or 5 days a week. If you had a half an hour, 4 days a week, for a total of 2 hours, that's much more effective than trying to knock out 2 hours of reading intervention in one day. You're not going to get the same results. So they said, providing it 3 to 4 days a week. And most of these reading programs are designed to last anywhere between, say, 30 or 35 minutes and an hour. Many of them around 45 minutes per session. And so those are some things that I would take a look at, and kind of going back to what I was saying earlier too, in terms of really understanding who's delivering the intervention. So, I gave an example of maybe like, a teacher with minimal training through a program like Spire versus, maybe a teacher who's gone through more extensive Orton Gillingham based training and certification. But even within that classroom, is it the teacher with the training that's delivering the intervention, or is it the instructional aide that's delivering the intervention? So I think there's a lot of contextual factors to take into consideration and really get clarity on at the IEP meeting in terms of, again, not just the frequency and the duration of sessions, but who's delivering the intervention.
Mhm. And I think all of these factors are really important, not just for the initial offer of FAPE, right? Meaning, so, your child has an initial diagnosis or a profile indicative of dyslexia, and are asking these questions to try to get a clear picture about what the program is that's being offered. Does it check these boxes? But also, what I see frequently are students who, on paper, have structured literacy intervention, and districts will purport, well, we're using a research based program, but then you got to unpack these nuances, right? And ask these
Yeah.
questions really explicitly. And so that could underpin why a student is in a program that, on the surface level, is research based or structured literacy, but isn't actually making progress because of
Yeah.
things like the group size or the training level of the person administering the intervention, or how frequently it's being delivered, or the quality of the program itself.
Yeah.
So I think these are all good things to take note of and think about, so that you don't feel too rebuffed if you're a parent just saying, well, we need structured literacy, and the response is they're getting that.
Right.
I think the other thing that I like to tell parents is, students respond differently sometimes to different programs. So, some students will not be making program or progress, excuse me, in one program. They switch to a different one, and we see more progress. So, each one can have a slightly different target. Like, some are a little heavily or more heavily focused on orthographics versus phonological processing,
Right.
or a kid just may respond to the structure and kind of the style of one program over another. So it's really not a one size fits all either.
No, it's not, and that it's a small number of children with dyslexia, but there are a small number of children with dyslexia that don't make significant progress with scientific based structured literacy instruction. I have had some clients, for example, that invested a lot of time in these interventions, and they didn't get the results they anticipated, and then they started working with somebody who specialized in structured word inquiry, which is a sort of a completely different approach to learning how to read and write, and had responded much better to that too. So, even with quote unquote research based intervention programs, even with somebody who's certified dyslexia specialist, the response isn't equal across the board for every kid.
Mhm. And so, what should you do if you're concerned about the school's program, or your child isn't making progress in their current structured literacy program?
Yeah, well, I think that last piece is something that all parents should be aware of, right? Is really um, you know beginning with really well written IEP goals, right? If they have difficulties with reading, we want to make sure they have goals related to the various aspects of reading that they're struggling with. If they have difficulty with phonemic awareness, we should have goals around phonemic awareness. If they have trouble with decoding and reading fluency, we need goals in those areas. And we need really well-written, measurable goals so that when we get those progress updates, we can tell whether or not they're making the anticipated progress towards meeting that annual goal. So as parents, it's really important that we're keeping track of those things. Along those same lines, really understanding, what the goal says and how that skill is being measured, because oftentimes we can probe those same skills at home too, right? So we're able to see whether or not they're able to demonstrate the skills at home that the school's saying that they're able to demonstrate at school. So one is really understand what those goals are and knowing whether or not our child's making progress towards those goals. Hopefully, they are making adequate progress towards those goals. But if they're not, we want to be aware of that because we want to be able to change course when needed. So if our child isn't making progress on those goals, certainly we want to call an IEP meeting to discuss that with the rest of the team. We want to look at the various factors that might be contributing to that, including a lot of the different things that we talked about today. About the training of the person delivering the intervention, what the intervention that's being used, the frequency and the duration of sessions, the group size, etc. And if we seem to have all of those things um, uh, to structure to the best of our ability at that school, we may need to look outside of the programs offered at that school in order to get our child in a program that's going to be effective for them.
Mhm. Mhm. And what are some of those private options?
Yeah, so whether it's we're doing as a parent doing it privately or perhaps asking the school to fund outside intervention because that may be an option too if the district's unable to provide the service that our child requires. There's people who provide this service privately outside of the school setting. There's Linda Mood Bell centers. There's Barton certified instructors. There's people that are certified in delivering Wilson Reading Program and others. So there's certainly a lot of people outside of the school that really specialize in providing this type of instruction for kids outside of the school day. And maybe that's something that either we're funding privately or again, maybe the school is funding because their reading intervention program isn't effective. And there's also a number of schools, certainly here in the Bay Area, throughout the Bay Area that provide dyslexia specific education. Where not only do they deliver the reading intervention, whether it's Wilson Reading or Slingerland, they've got a class during the day where they're receiving that an hour a day every single day. But then a lot of the supports that are helpful for kids with dyslexia are really embedded in the program throughout the school day. So their use of assistive technology, or even in classes outside of their language arts class or their reading class, the teachers are trained in dyslexia education so that they can help reinforce those skills, across the school day and across the different curriculum.
Mhm. I think one other thing that we haven't spoken to yet that I think would be important to touch upon is the age of intervention,
Mm.
early intervention. So I think there is more of a societal and cultural awareness that, for example, you can identify markers of dyslexia in kindergarten, where there was talking points for a long time that, oh, we can't diagnose or identify a reading disability till third grade, for example.
Yeah.
So there's the wait and fail approach. And now, I know there is more of a legislative push and more of, again, like an educational push to do more early indicator screeners, for example.
Right.
But can you talk through, um, you know, movement or progress in that area, or things that parents should still be on the lookout for if they are getting pushback about testing early for dyslexia, as well as the criticalness of having early intervention for these types of reading disorders, dyslexia specifically?
Yeah, for sure. And you're right. For a long time, there was this idea that you couldn't even identify a specific learning disability until third grade. That's wildly inaccurate. There's always sort of like kind of quote unquote rules of thumb that you hear a lot of times in school that aren't based anywhere in any sort of special education regulation or in the literature around learning disabilities. So this idea that you had to wait to third grade was based on this myth that you had to be quote unquote 2 grade levels below your in reading, writing, and math to qualify as a specific learning disability. And again, that's nowhere in the regulations. That's nowhere in the sort of scientific literature around reading or other learning disabilities. But that was a sort of kind of informal rule of thumb that schools would oftentimes use. So they thought, well, how can you identify a learning disability in kindergarten because you can't determine that they're 2 grade levels below because they haven't been in school for enough years in order to be able to determine that. So that's patently false. Again, it's not legally accurate or clinically accurate. And the fact is wait till third grade, we're really losing the prime opportunity to provide the most effective intervention. So with reading intervention, there reading intervention can be effective for people with dyslexia all the way into adulthood. So I want to be very clear about that. There isn't a point at which we sort of miss the window where we can no longer provide intervention. But there is a developmental window when these interventions are most effective. And it just has to do with the development of, of our, superior temporal lobe, and it just has to, biological brain development. And that window for reading intervention to get the biggest bang for our buck is really between the ages of, when we're looking at phonemic awareness, at least between the ages of 4 and 7. And again, because of that, we're going to get the biggest bang for our buck at younger ages if we can provide this type of intervention. And as kids get older, again, we can effectively treat it, but it's going to take a lot longer. The progress is going to be slower, and the amount of investment of time and resources in order to be able to narrow the gap is going to be much greater. So really, when we're looking at school age kids, if we can identify kids that are either have dyslexia or at risk of having dyslexia, in kindergarten and first grade, we can provide the most effective reading interventions, because we can really do a lot to improve, their phonemic awareness skills. And again, that's really the linchpin in, effective word reading.
Mhm,
I think I've seen some studies showing that if we can intervene in kindergarten and first grade, we may be looking at something like 80 to 100 hours of structured literacy instruction and phonemic awareness training in order to begin narrowing the gap between them and their peers. So we're having a really statistically significant impact on their reading development, not just improving their reading skills, but improving their relative standing to their peers. And if we wait beyond that point, if we're waiting till 8 or 9 years old when the child is in third grade, it's going to take much longer to remediate those skills.
mhm, mhm. So really speaking to the importance of that early assessment and that accurate diagnosis early on, and advocating for the assessment through the school system, or if parents are financially able to go out and get a private assessment to identify these types of disabilities early on. I think the last thing that we haven't talked about today that I think would be helpful for listeners is stealth dyslexia. So I know
Mhm.
that this is coming up more for students or children who, are reading at about average levels, but they still are showing challenges in these front end reading skills in relation to their other cognitive abilities, which may be more on the gifted side.
Mhm.
So can you talk through the kind of growing awareness of what stealth dyslexia is, and how there can still be adverse academic impact of that disability on reading in relation to other abilities, but also in other areas, particularly around anxiety and depression and socio-emotional well-being in the population of stealth dyslexia?
Yeah, no, it's an important question, and unfortunately, one that's increasingly recognized. If you go to the California dyslexia guidelines, which, oh, gosh, I believe came out in 2016 or 2017, that there is a section in the guidelines where they talk about individuals, high achieving individuals, high intellectual abilities that still have the same sort of dyslexia profile, right? In that, when we look at the areas of processing related to reading development that we talked about earlier, namely phonemic awareness or, orthographic processing, for example, that they continue to have deficits in those areas, and it continues to impact their reading development. And even when we're looking at brain imaging studies, the brain imaging studies are revealing a pattern consistent with dyslexia as well too. So there's this population of individuals that have dyslexia that might have above average range intellectual abilities, above average range verbal abilities, yet their phonemic awareness and orthographic processing and maybe rapid naming skills are falling sort of at the low end of the average to below average range, and it is impacting their reading development. And so while they may be, some of these individuals may be reading within the kind of quote unquote average range, it's usually at the lower end of that average range. And it, again, not commensurate with what their intellectual abilities are, or what their verbal abilities are. Again, increasingly recognize that these individuals do have dyslexia. They do benefit from dyslexia intervention, like scientific-based structured reading intervention. Um, but you mentioned also just the mental health impact, right? And so we have these kids with above average range intellectual abilities, who are struggling in school and may not really understand why. They understand things at a high level when they're listening to information, or visually observing information, but then they have to read text and they can't keep up with the reading, and they start to fall behind in school and feel that somehow they're not capable, as they actually are, because they're unable to keep up with the reading demands in school.
Well, thank you for talking through that. Are there any other topics related to dyslexia and what to know as a parent that we haven't covered today that you want to make sure we take some time to discuss?
No, I mean, I feel like we covered the topic, pretty well. I would say that if you have questions about whether or not your child has dyslexia, to reach out to a professional. If you live in the Bay Area, you can certainly reach out to us at the Byland Clinic. But I would say if you have concerns about your child's reading development, to look at getting them evaluated to see whether or not they do have dyslexia, and doing so as soon as possible so that you can provide them with the types of interventions that they're going to require in order to be able to become a proficient reader.
Perfect. Well, thank you very much, James.
All right. All right. Thanks, Daniel.